Bismillahirrahmanirrahim. I hope you guys can hear me. Am I clear?
Yes.
Very clear, very clear.
Okay. Okay. Okay, thank you. Okay. To all attendees, welcome to Program Bicara Kesehatan. The event is going to start any minute from now. The attendees are reminded to turn off their microphone so that the event can run smoothly. I hope the audience can give their full concentration during the talk that will be given. Thank you for your cooperation, and may this event be a success. The link for the attendance form is available on the chat box, or you can scan the QR code displayed right now to fill in the form. For your information, this event will also be available to stream live in Al-Amin Tropicana YouTube channel, and there will also be a link to the attendance form in the description. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Welcome to program Bicara Kesehatan. This talk is organized by Medical Student Association Club (MESTA) from University Teknologi Mara Sungai Buloh in collaboration with PTA of Al-Amin Tropicana School. First of all, let us express our utmost gratefulness to the Almighty God for giving us His blessings and mercy, granting us the chance to attend this program today. Before we proceed with today's agenda, we will begin this event with the recitation of Dua led by Haji Ajwad, while for the non-Muslims, you may pray accordingly to your beliefs.
Al-Fatiha. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya wal mursalin wa ala alihi wa sahbihi ajmain. Allahumma innaka khalaqul azim, innaka samiul alim, innaka ghafurur mahir, innaka rabbul arsyil azim, innakal barrul jawadul karim. Ya Allah, Engkaulah yang mempunyai segala kepujian, Engkaulah yang berhak menerima segala kepujian, Engkaulah yang berhak menerima segala kesyukuran, Engkaulah yang memiliki segala pemerintahan di tangan Engkau, segala kebajikan kepada Engkaulah kembali segala urusan. Ya fa'alul lima yurid. Kami juga memohon perlindungan daripadamu dari segala perkara yang boleh mencacatkan segala atur cara dalam majlis ini dan dari segala perkara yang boleh melalaikan kami dari mentaati perintahmu. Dan kepadamu jualah kami serahkan segala urusan kami. Rabbana alaika tawakkalna wa ilaikal annabatna wa ilaikal masir. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa barik wa sallam. Walhamdulillahi bil alamin.
Thank you, Haji Ajwad, for the Doa recitation. Ladies and gentlemen, this time of pandemic, I hope all of you have been well. Thank you for your participations. We are really delighted to have all of you here today. My name is Akil Hanif bin Muhammad Helmi, Year 1 Medical Students, and I will be the moderator for today's event. Before we proceed, I would like to invite Dr. Noor Asikin binti Abdul Aziz, Program Advisor and also member of Parent-Teacher Association of Al-Amin Tropicana School, to say a few words and to officiate this event.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning everyone. Alhamdulillah, thank you very much Akil. A very warm welcome to each and every one of you. I am Noor Asikin, the advisor of this program and also a member of the PTA of Al-amin Tropicana School. I'm not going to take too much of your time. I'm just going to say a few words here. I would like to express my sincere appreciation to the organizing committee, which includes all members of PTA of Al-amin, MESTA, and also MPP of UITM Medical School. Thank you to Ustaz Usai, the headmaster of the EATS Primary School, Teacher Ning Asmawati, principal of EATS Secondary School, and also Encik Khalil, the head of the PTA EATS, for the continuous support and also encouragement for this program, right? And not to forget our speaker today, Dr. Joanne, for saying yes to this program and willing to share some knowledge and her expertise with all of us today. All of you have tirelessly and generously helped us make this program or this event become a great success, inshallah. All right, we all know that this COVID-19 pandemic era has triggered arrays of economics and also psychological issues. And our concern is, of course, our children and also our students, right? As we all know, childhood and adolescence, these are the two critical stages of life for mental health and its development. And on that note, recent data have shown that there was quite a number of psychological related cases committed by teenagers ever since this pandemic started March last year. And based on a recent study, the mental health symptoms, especially depression and also anxiety, have been overwhelmingly prevalent in our Malaysian population. Clearly, intervention is needed to prevent mental health problem from happening, especially to our children. So here comes the objective of today's program. We are hoping that by listening to Dr. Joanne's talk, together we can learn about what are the commonest psychological issues or problems that can happen or that can be seen in our children and during this era of pandemic, and what can be done and who do we talk to, right? And we hope that this can be the first few steps before any intervention can be done, inshallah, right? So with that, thank you very much again, and please enjoy the talk today. Assalamualaikum.
Thank you, Dr. Noor Asikin, for the wonderful speech. Ladies and gentlemen, please allow me to give a little heads up regarding our topic today. Today's talk will be focusing on mental health issues entitled Psychological Issues in Children After Pandemic. I hope our event today can inspire and motivate each and every one of us on how to survive in this new norm. Without further ado, I would like to introduce our very remarkable speaker today, Dr. Saw Joanne. Dr. Saw Joanne is a senior lecturer in the Department of Psychiatry, Faculty of Medicine, University Technology Mara, and clinical psychologist in Pusat Pakar Perubatan UITM, Sungai Buloh. In 2008, she graduated with first class honors in Bachelor of Social Science Psychology from University Tunku Abdul Rahman, Malaysia, and was awarded the Book Prize 2009 in recognition of her outstanding academic performance. In 2012, Dr. Saw Joanne completed her Master of Human Science in International Islamic University Malaysia, majoring in clinical and counseling psychology. In 2020, she received her Doctor of Philosophy (PhD) in Monash University Malaysia with her research area School-Based Cognitive Behavioral Therapy Intervention for Depressive Symptomatology Intervention for Malaysian Adolescents. Dr. Saw Joanne has been in the education field for nearly 16 years, including her internship experience as clinical psychologist in klinik multidisiplin, unit psikiatri kanak-kanak dan remaja, as well as in Jabatan Psikiatri dan Kesihatan Mental Hospital Kuala Lumpur. Now, she is a member of Malaysian Society of Clinical Psychology, despite being a senior lecturer and clinical psychologist in UITM. Thank you, Doctor, for accepting our invitation and sparing your time today. We are glad to have you here as our special guest. Do take note that there will be a quiz at the end of the talk, and whoever fills it will stand a chance to win exciting prizes. Finally, it is the time that all of us have been waiting for. Let's now shift our attention to our speaker today, Dr. Saw Joanne. Doctor, the floor is all yours.
Thank you so much. Thank you so much, Mr. Hanif. It's a great pleasure, a very good morning, to all parents, teachers, and thank you so much for the organizing team for inviting me over for this wonderful talk. This is definitely a great pleasure for me to be on board and also to share some of my experiences, with parents. And I can see, little students are also here today for the talk. So thank you so much once again, and hopefully we could have a good sharing session. And at the end of it, definitely by all means, we can have some discussion or Q&A sessions, between us. So maybe let me just quickly put up my slides and share my PowerPoint slides. Okay. Is it visible to all of you, the slides?
Not yet, Dr. Joanne. Okay. I think it's coming. Yeah, all right.
You see, the stresses with the internet as well, not to mention, some of other stresses.
That is definitely true.
Especially with online learning and teaching, I'm sure, there's a lot that we could share, shortly later. Oh dear, is it visible?
Not yet. We can see your...
I'm presenting, isn't it? But then there's no slides.
Maybe you can stop sharing and reshare again.
Oh, okay. Oh dear, my apology. Let me just try again. Normally it works when... Okay, I think it should be there. Am I right? Is it visible?
Yeah. It is. Yeah, it's just
Okay, great.
it is not yet in the presentation mode. Otherwise, we can see the slides already.
Okay, cool. At least it's there. Yes, wonderful. So, yeah, if it's visible, let us just begin. Yeah, as I was told, why not talk a little bit about the psychological issues in children after a pandemic? Yeah, so we are talking about COVID-19 right now. Yeah, so I'm Joanne. Yeah, so as being introduced, thank you so much for the great introduction. So let me just proceed with what are we going to look at today. Yeah. So these are the outline. Yeah, I put it very simple. Yeah, we are going to look into COVID-19 in children. Yeah, and we wanted to recognize the sign of stress in your child, because I presume I'm talking to most of the teachers and parents over here. Yeah, we need to start to see what are the red flags. Yeah, what are the things that we need to take note. Okay, and how do we actually support our child? Yeah, the support and protect. Yeah, not only on physical, behavioral, yeah, we need to provide emotional as well, the
Dr.
well-being
Joanne,
and the
sorry,
safety of the children. Yeah,
your slide is not moving.
yeah, I'm still in the first slide though.
Oh, okay.
So
Okay, so you're
sorry.
still on the
I'm
first slide,
trying
eh?
to,
Okay, okay, okay.
correct,
I
correct.
thought
I'm
it's not
still in the
moving.
first slide.
Sorry, I'm so sorry. All right, all right.
No worries. Okay, then we will look a little bit into how teachers can help, because this is a great initiative here from school, from the organizer. What possibly should be the do's and don'ts, yeah, and how teachers could actually play a part in this pandemic as well. And last but not least, I need to emphasize a little bit on self-care among the parents and teachers. I think this is the one of the ultimatum as well. Yeah, it's rather important. Yeah, so I kind of like this little picture next to it, because I think we are kind of in this situation. Yeah, but let's not go further into this, but it reflects our situation right now. So, in fact, how is your child coping during pandemic? In fact, yeah, you see, I've picked up from two particular rich journal, yeah, which was done last year. So they have actually picked up quite a few things, yeah. As Dr. Shikin has mentioned, yes, anxiety and depression has become so prevalent and it's so overwhelming in the setting, yeah. And of course, news has also mentioned suicidal cases has increased among the adult. But forget not, yeah, self-harm, high-risk behavior is also part of it that we need to look at, yeah, on top of anxiety and depression. Yeah, but through this research, which was done in Hong Kong and in abroad, yeah, they actually found out that the child starts to become very uncertain, agitation, yeah, because it's a systematic review. So they kind of collected all the information of all other researchers of how actually the child is actually responding, yeah, fearful and isolated. They were fearful. Even we are fearful itself, yeah. This MCO, we have never encountered this kind of pandemic where, oh dear, lockdown, we are stay at home, we are not going to go out, you know, certain areas with, you know, those barbed wires, yeah, or police cars patrolling all over. You know, all this kind of scenario not only creates fear to us as an adult, but to our children as well. Yeah, and inattention, started to lose focus, yeah, and disturbed sleeps and nightmares. This is so prevalent among the child, you know, our children. Okay, and separation related anxiety. This is so pertinent, especially when the parents are working as in the essential industry, or the parents are actually the frontliner. Yeah, so there are issues in terms of the separation, and child became so worried, yeah, once the parents are stepping out of the house. Yeah, so all these are the collated traits and also symptoms through all this mass research that we could look at, yeah, where how is our child actually coping with the pandemic? Okay, but not to mention this, let us just go a little bit further. To me, it's rather important because we need to recognize the sign of stress in our child. What is happening? Yeah. So I kind of split it because it might be a little bit different in terms of
Doctor,
infants, toddlers.
doctor,
Yeah,
I'm so sorry
yeah,
to interrupt, but I believe
yes.
the slides are not moving. Are you moving the slides already to the second or third slide?
Recon- yes, recognizing sign of stress in your child, infants,
Uh,
toddler, and young children. Can you see this line?
no, doctor, it's still on the first slide.
Oh, they are so. Okay, can you all see the slides with the father holding a baby crying and
No, doctor.
carrying a. Oh dear, how do we go about it? Yeah,
Mm,
why is it like
can you
this
try
today?
press the presentation mode?
Okay, can you see if I keep it like this? Will it be
Yeah,
better?
Yes,
yeah.
yes, doctor.
Right now the slides are on the fourth slide.
Okay, wonderful. Shall I just keep it this way so that we could actually go through it easily rather than you're not sure whether if I've moved my slide or not. Then I'll be like happily talking at my end without realizing it's actually not moving. That's really bad. Okay,
Okay,
okay. Is
yeah, I
this
think we can
reasonable?
take. Yes, yes, yes.
Okay, cool, cool. Okay, so as I mentioned earlier, I think it's important for us to recognize the sign, yeah, the red flags, or how can we actually take note of our children, yeah. So I've split it to infants, toddler, and young children, and older children and adolescents in another category. So why not we look into the younger ones, yeah? So they may actually show some sort of a backward progress in their learn skills. So you could be expecting, they have learned it, but then doesn't seems to be showing improvement in their learned skills, or they actually slightly keeping at that stage or slightly regress a little bit. Maybe they might be saying more words. I wouldn't say that it go regress backward. That is another sign of psychological issue, but they are not showing any sort of learned skills or improvement, or rather stagnant, yeah, at that stage. Or we even observe, yeah, bedwetting. Bedwetting is quite common. Even they have been potty trained, yeah. So in fact, when we talk about bedwetting, we are considering on two aspects. Number one, it actually most of it arise due to anxiety, being anxious, being fearful, and it is reflected through bedwetting in a way, which we could see. Yeah. So our child, we could see that even if they have been potty trained, it happens throughout the period. That is one thing that we need to look at, meaning that it is an indication something is running and it is a bit unhealthy inside. Yeah. And I'm not sure, but I've been seeing patients recently, parents has been sharing with me that, what, Dr. Joanne, recently, my child has been throwing temper, intense tantrum. Yeah, they might start hitting, showing frustrations, biting. Yeah, very frequent of temper tantrums. And I'm quite sad to hear this because this one particular patient of mine, the child is actually having autism. So she was telling me that she couldn't bring the child out for jogging, the usual routine that they have fixed for jogging and going out and so on, with the fear of the pandemic, with the fear of and certain restriction that was happening in the area. So she told me that the head banging behavior was intensified. This is so heartbreaking, in fact. Yeah, I'm not talking about temper tantrum right now, but rather throwing tantrum, kicking the mother. All these are being more and more intense. Yeah, and you could see, the siblings are fighting, showing more intense kind of tantrum. This is one of the signs that you want to look at. Yeah, or they just, crying, throwing temper here and there, which it's very unlikely or which is so uncommon in the child. Yeah, as that would lead to the fourth point where they become so fussy, so irritable. Yeah, they just cry more easily, and as we said, just very minor stuff, they started crying, they become very fussy, not happy with it, picking on food, do not want to eat, you are actually getting more, finding more difficulty to handle them. Yeah, very hard to console. They will go on and on and on. Yeah, if you notice. So this is one of the things that, okay, we need to pay a little bit more attention. This is not so right. Yeah, because I believe it's not only us coping, not only us, the adult, are coping. The children are also learning to cope, but probably with certain restriction within that. Yeah, and also separation anxiety, as I mentioned. Fair enough. They started to be having some fearful, very clingy. They tend to stick to the mother. It needs to be carried. Yeah, needs to be stick to the parents. Yeah, or they do not want to go and explore, because when we talk about infants, young children, toddler, it is the time where they started to go and very curious. They wanted to learn, they wanted to see, they wanted to explore. No, they started to pull back a little bit. They started to very clingy, lost the sense of safety. Yeah, this is what we observe. And fair enough, as I mentioned earlier on, not only the research indicated, but it is so obvious, which we could see in older children and adolescents as well, in terms of sleep. Or they might having interrupted sleeps, difficulties to get them into sleep, or easily awaken in between the sleeps. And so these are some of the, I would say, something that we could take note on. Yeah. In terms of our child. Yeah. So sleep is something that is so obvious, I would say, and prevalent here. Okay. So what about the sign and of stress among the older children and adolescents? Yeah, not the babies, not the toddler, not the infants, but slightly older ones. Yeah, what we could see in them. Okay, so you would see that among the kids, adolescents, yeah, they start to lose their interest. Whichever that they used to love, they used to like to do, they enjoy, they seems to be losing the interest. Yeah. So I would not mention about the diagnosis or psychological disorder per se, because to me, I think it is rather important for us to look into the sign, the symptoms, because these are some of the red flags. We do not want to wait it to become a clinical impression later, which is too late for us to take note. Yeah. So losing interest is one of a big thing that we need to look at. They no longer have the interest. They no longer want to do what they used to. Yeah. So this is a sign that, okay, we need to look seriously into it. Yeah. And changes in mood. Yeah, the children started to say, not only the younger ones, the toddler. Okay, of course they might not sitting and crying like the babies, but then you will see that they become more easily irritable, or sometimes full of rage, and or sometimes they just feel anything, not so hopeful. Okay? Or they started to engage in fights with friends, with family members. Yeah? Conflicts. Things doesn't seem right. That's always collision. Yeah? Probably more among adolescents. Yeah? And changes in behavior. We could see that they start to step back from their personal relationship. They no longer want to text. I don't want to call my friend. I don't want to video chat. Adolescents, they start to step back, be it friends or be it family members. Yeah, because when you talk about adolescents, at their stage, yeah, adolescents, they are engaging so much with friends. Friends are almost like everything to them. Very important. Yeah? So they start to step back. This is one of the signs that we need to look at. You know, not putting any effort into engaging personal relationship. That's worrying. Yeah. And you see, same things happen again. Hard time falling or staying asleep. Awakens, a lot of awakenings, difficulty to fall to sleep. Or if you take note of this, the older one will start to sleep all the time. They engage into sleeping all the time. daytime, nighttime. They spend so much of the time in sleeping and just dozing it over. Okay? And of course, not to mention less interest in schoolwork, drop in academic effort. We don't measure the performance still. We talk about effort. We see it's dropping. It's not there anymore like how your child used to be, putting up revision, putting up discussion, doing up homeworks and things like that. We could see a reduction in that. Yeah, because performance is a bigger word. Performance, we are trying to grade, the child, but having pandemic and things like that, we might do not put performance as a key indicator, but rather the effort, the academic effort is important. Yeah, but for older adolescents, if you could see, probably an increase in risky or reckless behavior. Some might start to involve in drugs, involved in alcohol, involved in those risky behavior. Yeah, as a very unhealthy coping mechanism. Okay, and whatnot, of course, the memory, thinking, concentration would be definitely affected. Yeah, there will be problems with that. Yeah, it definitely disturbs the whole concentration, our focus. Yeah, there will be problems in terms of that if you take note. Yeah, among the adolescents. Okay, so talking about it. Okay, how are we going to support our child during the COVID-19 pandemic? What are we going to do? What should we do? Because this is, okay, the pandemic has happened, but we are now still under the stage of MCO, and I believe today is the start of most of the area in KL and Selangor of EMCO. So I would rather put it as during still. We are still in the stages of facing the pandemic. What can we do? What should we do? Yeah, in general, we would go one by one. Oh dear, I'm not so happy with this because it really disturbs the whole slide. I'm so sorry. Let me just try again. Let me just try again in a bigger slides. So because this is like so. Okay, let us just give it a try. If it's not moving, you let me know. Okay, yeah. So very important. The first thing we have to
Sorry, Dr.
understand.
Joanne, have you
Yes?
put it in the presentation mode?
Yes.
Or it is still in the
Oh dear.
sorting
Small
mode?
one, yeah.
Yeah.
Oh dear. Okay, now I started to have some agitation. Not like children,
I'm so sorry.
No, you see, things happen, it's this internet starts to misbehave, all these things
Dr.
gonna
Joanne,
happen.
I
Yes.
think it's okay to put it in the slide mode. You can just delete the box on top.
Okay.
Yeah. Let's see how it appears.
Okay, can I delete?
Yeah. You click on the box at the edges of the box. Never mind. Okay. Just click. Just delete it.
I just put it up here. Okay,
Can
come.
also.
Okay, come.
All right.
Oh
Dr. Joanne,
dear,
can you
my
also?
apology, my
No
apology.
problem. No problem. This happens all the time. All the time. The slide on the left. Can you reduce
Smaller
the
it, yeah?
size? Yeah. So that
Sure.
the ones. Okay. I think it's
Cool. Will it
better.
be
Yeah.
bigger?
Yeah. I am so
Okay, now
sorry.
it looks
I am so
better.
sorry. Okay. Yeah.
It's okay, please, because I wouldn't know what is at your end. It looks okay to me right now. Yeah, please let me know.
Okay.
Yeah, if it's not clear or
Actually,
anything.
good idea. There's someone suggesting that you can increase the size. Can you see yeah. A little bit more if that's
Ah,
okay.
okay, probably not so
Okay.
centered, but okay. Come,
But
let us
it's
just
okay.
go with this. Yeah,
Thank you very much.
cool. So these are one of the challenges, during pandemic. Oh dear. Okay, come, let us just get started again, because there are 4 big things that we need to look into this matter. As a matter of fact, we need to understand that reactions to the pandemic may vary. Each and every one of us as an adult, we might reacting it very differently. Not to mention our kids. Yeah? Our responses to stressful events are really unique. It varies, yeah, because it is something really new and it's really something really challenging, yeah. And for us to react to it, it really varies among us. So it's just that we need to set up a limit when it's needed for us to understand and also to react towards this pandemic. I think we have to accept the sheer fact that everyone is reacting differently. Everyone has a different reaction. Everyone is going to react to it, and everyone is trying to cope with it, but it just in a different manner. Same as our children. Yeah, I might react differently. Dr. Shikin might react differently. Mothers might react differently. Fathers might react differently. Yeah. So when I have session, both parents came in. The father looks cool. Everything seems fine, but the mother has lots of things to share. Then the father look at the mother one look. Yeah, no, this is not good. Yeah, you are actually in the same boat if you need to support each other. Yeah, but that's what is happening. Reactions gonna be different, definitely gonna be different, and we need to accept this. Yeah. If we are not accepting this, it is quite hard for us to progress further into this pandemic. It's a long run. It's a long run for us. It's gonna be something that we need to fight through it. Yeah. And secondly is for children, we need to ensure the presence of a sensitive and responsive caregiver. I'm talking about caregiver, the parents, the family members, grandfather, grandmother, or even some, who has maid, kakak, and so on, they are also caregivers, teachers. Yeah, all these are caregivers for the children. Yeah, we need to ensure the presence are there. A supportive and caring adult is there. We need to be consistent. We need to be sensitive. We need to make sure that our presence are there, yeah, to give them the same sense of safety. Very important. We need to be there. Our presence needs to be needs to be felt by the children. And the third one would be social distancing should not mean social isolation. Okay, because research has indicated that social connectedness, it actually improved the child of showing resilience. We are saying that resilience to adversity, we are saying resilience to the pandemic. We want the child to actually bounce back. We want the child to be able to learn, to be able to cope, be able to adapt. Yeah? So the social connectivity is very important. Yeah, it doesn't mean that yes, those social distancing SOP, but we can use different approach, a lot of approaches. Yeah, we have lots of apps, we have lots of programs, we have lots of activities. We just need to make use of the creative approaches, be it online chatting, message, or anything. Make use of the creative approach so that we could still maintain the connectivity. Doesn't mean that social distancing, we are not talking, we are staying in the house, covered by, no, we are not. We need that so that our child can actually learn to adapt, to cope, and also to bounce back later on, which we are talking about resilience. Yeah, there will be a big chunk of topic again, if we wanted to talk, on resilience later. What's next? But now we are handling during, but also what's next. But we are actually starting to experiencing the effect, even the children as well. And last but not least, age appropriate information regarding the pandemic. Sometimes we feel like, okay, don't tell them so much. Don't, we withhold all this information. It might be something scary, or it might be something stressful for them. We thought, but it's actually not. You withhold all the information, not telling the truth, is actually creating more stress to the children. Try to imagine, your youth, your teen boy. You withhold, but then he is also exposed to certain of information. Then he got confused, and the information might not be appropriate. The information might not be right. So we should be the one to convey the truth in an age-appropriate manner. And we need to make ourselves available for children to ask questions, for children to ask whichever concern that they have. And we limit our children's exposure to the media coverage and social media. We need to limit it, yeah? Because if we don't, probably they are getting information that is not right. They are getting information that is not age appropriate and creating unnecessary fear. So these are the 4 things that we need to get in hand before we move on to the next one, which we wanted to talk on the physical and emotional safety. I put it into 3R. 1, reassurance. 2, routines. And the third one, regulation. How are we going to tap on this aspect? Okay. Oh, there doesn't look good. Okay, I hope you don't mind. Okay, so for the first one would be reassurance. We need to reassure our children about the safety. We have to assure telling them that about their safety and what not, the safety of loved ones. Yeah? For all you know, our kids are very sensitive. They worrying their parents more than they're worrying themselves. They're concerned about their siblings more than they're concerned of themselves. We need to assure them about the safety of themselves and also others in the family. Yeah? And also we have to emphasize strength, hope, and positivity. Don't keep on throwing negative thoughts, negative ideas, or how bad things are. We are talking about how the SOP, we are talking about all this sort of negativity, but rather try to find a shed of positive lights and emphasize on it. The assurance really matters for our children. With that assurance, we also need certain routines. Okay, we need to maintain the routines. We need to ensure that everything is still regular as how it used to be. This is how our children will feel, okay, this is safe. Okay, because I still wake up, I have my breakfast, I will play my toys, then later on I'll have my online class, then I'll do this, then I'll sleep at this time, I'll play, I'll do homework, all these sort of things. They know what is expected. They know what is going to be done. The sense of safety is there when we maintain the routine. Okay, even our work schedule. Let them know. Oh, mommy got to go to work today. I got to go to the hospital on every Monday. Fine, let them be aware. They predict, oh, okay, it's Monday. Mommy got to go. Okay. They know what is expected. And increase their self-efficacy. Self-efficacy means the ability for them to make things within their control. Yeah, put them into the active roles. Washing hand, sanitizing, allowing them to have this active role is actually helping them to have the sense of self-efficacy. And also we guide them for the safety guidelines. So when they have an active role in this, sometimes we'll say, okay, no, you stand aside, you sit aside, you hide in the room, I'm going to do all this. No, we got to introduce them how to take care of themselves. Yeah, how to have a proper way of wearing masks. How do you dispose masks? And how do you sanitize your hand? All this actually puts them into the active roles in the family. Yeah, after weighing the, of course, the pros and cons. Yeah, we have to ensure that it's age appropriate. Yeah, and then we need to regulate. Regulate means we need to validate their feelings. Sometimes, I know that this might feel a little bit scary. It might be a little bit overwhelming, yeah. Or if with our adolescents, our teen boy or girls, I know it's a bit disappointing not to be able to, do some of the things that you did before the pandemic, And what are some of other ways, you can have fun, or like how you did with your friends. Maybe now you couldn't. We need to validate the feelings. Not saying that it's okay, you just don't need to meet your friends, you can do it online, we are not validating, but we are brushing it off. It actually created stress. We need to acknowledge, before the pandemic, you used to be, playing basketball and things like that. Probably we can replace with something else. or when things get better, you're getting back to it. We need to validate, yeah, and encourage them to engage in activities that help them to self-regulate, yeah, and encourage them to help them to regulate their emotion. Yeah, for children, maybe they do not know how to go for meditation or probably deep breathing. They might not be able to regulate, or having some me time, self-reflection. But then engaging them into activities could actually help them to self-regulate. Yeah, simple exercises, yeah, or regular routines. We set up regular routines for them for eating, for play, or do some sort of breathing, simple breathing relaxation, or even prayer. Engaging them in prayer, it helps. Okay, then what's next? How about managing emotions and behaviors? Yeah, parents starts coming in and complain, oh dear, they are throwing temper tantrum, they are misbehaving, they are, we need to redirect the bad behavior. Okay, it's not that, okay, it's pandemic now, okay, never mind, everything is okay. It's okay, never mind, okay, it's pandemic, it's okay lah, never mind if they misbehave or something. No, we are not allowing that. Clear expectation, rules remain rules. We need to have clear expectation, and we need to redirect the bad behavior, because we do not want to reinforce bad behavior, which later on is going to be a habit, and that's going to be a disturbing behavior later on. Yes, we do understand everyone struggles. This time, during this pandemic, things are bad, but we are not going to allow it to, it's okay, never mind, let it be. It's, no, expectation still needs to be there. And as I said, with children, it is very much we can engage into creative play. It doesn't mean that we are just allowing them to play here and there 24/7, day and night. No, we are making creative play as a form of regulating their emotions. You might play imaginative play with your children. Yeah, very important. Yeah, and also we need to direct the attention for good behaviors. We are still keeping our parenting intact, yeah, at this point of time, and discourage those bad behaviors. We focus on the good behaviors. Yeah, we use reward, yeah, and privileges to reinforce good behaviors. Yeah? Some sort of sticker, reward system. We still implement this despite pandemic. We still need to implement reinforcing good behaviors. And when we know, and we have to know when not to respond. We need to ignore bad behaviors. Really, because the more we are putting on into the bad behaviors, we are actually reinforcing the bad behaviors. But of course, at the back of our mind, we need to know what is happening. Why is my child keep on showing this bad behavior? Okay, at our hindsight, we still need to keep this in mind, but we are not responding to each and every of the bad behaviors. And we use timeout. If you could look into the picture, yeah, this timeout is actually, we have to talk to our child, explain to our child about the bad behaviors, and allowing a timeout. Means we are removing them from the situation for a set of time. You can't put 10 minutes, yeah, for a 2 years old. No, it's not going to happen. Yeah, so probably a 1 minute per year of age, yeah, is a good guide. So we are putting that, you have your timeout time for a bit. Then we are going to have a discussion after that. You explain why you are doing it. Why does your child needs to go for a timeout? Explain to them. Execute it. After that, we need to talk to them again. You know why mommy was saying this, the action that you've been doing is not right, do you think that this is going to cause harm, and this will be upsetting? We have a good talk after that. But we still need to manage the behaviors on top of what is happening. But at our hindsight, we need to remember that, take note of this, why are they keep on showing this to us? And how are we going to address their fear? Yeah? How are we going to address the fear? Number one, we show them how to manage feelings. We talk our own, we talk through how we ourselves as an adult manage our own feelings. For example, I'm worried about grandma because we can't go out and we can't visit her. Okay, I will put a reminder on my phone to call her in the morning and afternoon until it is safe to see her. We show them, yes, I'm actually worrying about your grandma, and now we cannot go out, restriction and travel, and it's also not good to have this kind of contact. Okay, I will try to call her every morning and night, check on her. So we have our fear. We have the fear of worrying the grandma. So we actually talk through it with our child. Okay? Or as I mentioned earlier on, we need to inform our child before we are leaving home, leaving our house for work. Because some of us might be in the front line, some might be in the essential category. Just let them know where we are going, how long will we be out, when are we coming back, what are we going to do. We are going to ensure and also assure them of that we are going to stay safe. And mommy going to come back later. Because of this pandemic has proven that the separation anxiety, the anxiety has actually increased tremendously. So this is a form of assurance for us to address their fear. And we have to include in of looking forward and being optimistic. Yeah, we can tell our children, our child that, scientists are working really hard, They are trying to see how to help the ones that are sick. They are trying to come up with medicine, or probably they are trying to research on, and things will slowly get better, Optimistic, something to look forward. We are relying on the scientists. Dr. Shikin, am I right?
Yes, you're very right.
The scientists, our experts here are trying to figure out how can we go about this? How are we going to help the people? Yeah, despite the frontliners, doctors, nurses are working on those who are already infected. But yes, we are telling our children something for us to look forward. Scientists are helping us. They are trying to investigate. They are trying to figure out. Yeah, and we offer more affirmation. Show more attention, show a bit of more intimacy, show a little bit more of affection. Tell them you actually, I love you, more often. Yeah, sometimes you might, oh dear, So, no, I'm not saying that. But I think it works. A simple line, it works wonder. Yeah? We are giving more affirmation at this period of time. You see, you are sweet and nice over here, parents, showing affection, showing love, and so on. But you do not run away from the boundaries of parenting. So this is what we call it as a very authoritative. Yeah? There's a strictness over there, and there's a form of love over there. Not those, authoritarian, which they say Asians are so authoritarian parenting. Everything, no. But I think authoritarian will work well here, because we are not only handling now, we need to ensure later on it could turn out right as well. Okay, how teachers can help. So this picture is actually taken from the WHO. So during the lockdown, during the period of the pandemic, so how teachers can help. Teachers play an important role, be it at a school, or be it virtually, or be it, in any sort of setting. Teachers play an important role here. Yeah, teachers can show their care by noticing changes in behavior. So in my practice, whenever I see patients, parents bring the child in for assessment and things like that, I always wanted to ask what teacher says. I tell you, teacher might probably notice the children much more better than me. With the experience that teachers have, with the child that they are seeing every day. Yeah, teachers, am I right? You people are great. Your experience actually tells you, okay, this is not right. Something changes.
I totally agree with you, Dr. John. Totally agree.
teachers work wonder, really. They can see, okay, some changes in this child, some changes in the behavior, okay, or early sign that we might overlook, but teacher can see that. They have been educating so many kids, every year, every day and then, and teachers are so wonderful. So teachers, you can also start to invite the students to connect. Yeah? Maybe now it's through emails and calls and so on, and also talking to the parents. Yeah, it is really important. I think parents rely so heavily on you to actually tell them what is happening, or some changes might not be obvious at home, but it happens in school. Yeah, so please show your care and concern, but rather than just push for information or just ask for pointed question, but rather invite for the talk, and also schedule regular check-ins, yeah, with the students or the family. Just check in. And don't, please, teacher, don't assume that check-in means busybody. No, or you're actually interrogating a family's affair. No. When you actually schedule a regular check-in, I'm sure parents would really appreciate it. Of your comments, of your feedbacks, of what you notice. Yeah, when you schedule regular check-in, students feel that, oh, okay, teacher Shikin is checking, teacher Shikin is messaging. The connectedness is there again. Yeah, please don't assume that you're a busybody or you are actually moving out of your context. No, you're not. Yeah, don't think of that and actually lend a ear. Sometimes you can just talk to the kids like, hey, let's very casual. Come, let's talk. And give them consistent attention. Yeah, because I know there's face-to-face session before early this year, and then online again, back and forth. I'm sure some of the children might be very comfortable with the teacher, with you lending an ear to them. They could actually tell you more. Yeah. And let students know you're the one of the adult. Yeah. Let them know. That's what I said. Parents, teachers, family members, caregivers. When you are there, you as an adult are there, they feel safe. Letting them know that, don't worry, teacher is here. Anything, let me know. It creates a sense of safety for them. Don't keep on saying that everything are fine, everything is the same, it's okay. We do not. We are brushing it off again. But letting them know, I'm here, teacher is here, teacher Siti is here. Don't, you can talk to me anytime. Yeah, we are going for class now. Anything that you're not sure, you can ask me. Or if there's anything outside of school things, you can also talk to me if you wanted to. And teacher is here, I'm here. With you saying that, for all you know, the children will be so relieved. Yeah, and do more listening. Yeah, sometimes, no offense, teacher, is like sometimes we really wanted to tell, especially adolescents, like, no, you're wrong, not like this. This is not the right way of you to conceptualize this matter. Sometimes we want to tell them more and more and more. And we wanted to dominate because from our experience tells that, no, this is so wrong. But having known adolescents, they want to be listened. They want to be understood. They want to be in charge of themselves, which this is the time you start to switch yourself to become friends. So parents and teachers always come and say, oh, dear, I'm having a headache, especially the adolescents, yeah, the changes, the turmoil there. Yes, but we need to do more listening. We need to be their buddy. We need to be the friends, yeah, so that they can talk to us. And keep the routines. Yeah, I do understand that, yeah, we might, but this is probably not a good time for us to give surprise assignment or last minute schedule, because I think consistency and routines are the key terms for children to ensure the feeling safe. So probably we might want to reduce a little bit of tomorrow quiz, or suddenly, okay, now I'm going to do a quick quiz or something like that. Yeah, or today I'm going to give you a special assignment. It actually I'm going to add on stresses, but with routines and consistency, we can include quizzes, we can include assignment. We are still throwing things to them, but then we try to keep to the routine. Okay? Because I believe the 3R matters not only to at home, but it also can be implicated in a school setting in terms of the 3R. Yeah, where we reassurance, yeah, routines, and also we validate the feelings. Yeah, okay. Last but not least, parents, teachers, you need to have some sort of self-care. I cannot say, how do you handle your child? How do you do this? How do you do that? But your children's well-being really depends on the well-being of their parents and other caregivers. If we are not getting ourselves straight or if we are not getting ourselves right, it's mutual. You might tend to throw our temper on them, or we might unload in the wrong way to them. It reciprocates. So then it will go on and on and on and on and on. So our children's well-being really depends very well on us. So first and not, we need to engage in self-care. We need to stay connected. We need to be having our support team with us, with your friends, husband and wife, father and mother, grandparents, teachers among teachers. We need to build up a good self-care for ourselves. We need to get enough sleep. Not only children will get cranky, we will also get cranky and starts to grumble, da 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 da. Okay, then there goes the day. We need to have enough sleep. Yeah, we need to take time, have some time for yourself. Yeah, restorative activities, whichever that you think is good for you. Or sometimes I like to ask parents, teachers, or anyone, us as an adult, to have me time, a time for yourself. A good 15 minutes a day is more than enough. Yeah, be it you want to sit down for do some sort of relaxation, yeah, prayer, or sit down to reflect, or as simple as just sit down listening to song and having a cup of coffee. Yeah, you need to restore yourself. Very important. Yeah, and you yourself, if the struggles are high, the struggles are real, the struggles are exceeded your resources, too taxing, or any other mental health challenges, please seek help. Yeah? Seek help. Yeah. So we as an adult, I think we should, yeah, also taking care of ourselves. Okay. And last but not least, yeah, seek professional help. If children are showing the sign of trauma that do not resolve relatively quickly. As we mentioned, it's expected. The changes definitely is expected during the pandemic. Things changes, yeah, but the ongoing pattern, yeah, of emotional and behavioral concern, say the nightmares, unable to focus, excessive of anxiety, increased aggression, or regressive behavior, or some even have self-harm, which we are quite worried. It does not resolve. Yeah, with your support or with management or with intervention within your area, I think it is time for us to look for help from the mental health provider. Yeah, don't worry. Sometimes we think, oh, now EMCO virus and everything, going to the hospital is dangerous, risky, exposure. Yes, we are providing services of teleconsultation. Yeah, lots of NGOs or even setting up providing teleconversation or virtual sessions. Even in hospitals, we are setting up a session or consultation virtually. Yeah? If there is a need for that, engage into this. If it doesn't resolve, yeah, we need to take action on this. We do not want for it to progress or get worse over the time. Yeah? Provided we have actually started on certain of support, a bit patchy, but if we could get things up, okay, fine, fair enough. But if it doesn't really resolve at all, then probably it's time for us to seek help. Yeah. So I think before I end the session, I think I like this poet's writing, yeah, because we cannot expect to have smooth sailing in the ocean of life. Tough times forge men and women to build strength and character. Then, with the renewed toughness, one can navigate the turbulence in the ocean of life. So, don't you dare think of giving up? These two and you keep forward. Yeah. Thank you so much. And these are the references.
Alhamdulillah, thank you, Dr. Soldier N, for a very informative talk. Now, we open the sessions to the floor. If any of you have any questions, you can either turn on your microphone and ask directly to Dr. Soldier N, or you can send your queries through the chat box or contact person, and we will choose a couple of questions for Doctor to answer before we end this event. I would also like to remind everyone to fill in the attendance form right now, especially for those who haven't do so, as well as filling up the feedback form. You can find the link to both forms in the chat box or in the description in the YouTube live channel or by scanning the QR code displayed right now. Okay, Doctor. So the first question is, I have 11-year-old daughter and she is entering her teenage phase. In the same time, there is still child behavior left beside her. Can you share your professional opinion, because there is a lot of time she rebels?
Okay, so yes, this is definitely a question among parents who are having adolescents, yeah, at home. So you see, each of 11, yeah. So we need to understand the sheer fact that they themselves are struggling. Yeah, they are trying to go through this phase of what we call as adolescence. Yeah, lots of things comes in, a sense of self, a sense of making decision for themselves, a very curious and explorative time of self-identity. Friends are, of course, the ultimate importance as of this point. Few things, a lot of things running over here in them. So number one, we need to acknowledge this struggle, which I say, parents, you need to be friends. You need to be buddy, yeah, with her. You need to sit down and talk to her like a friend. And you need to get yourself up to date, yeah, parents. You need to be like, okay, what is the latest Korean drama? You need to know what is the latest apps, what are they using, or what is the trend. I'm so sorry, parents, you need to get this in hand, handy at your fingertips, so that you can gauge into this conversation. That's number one, for you to gauge in. And second, how do you actually go about it? By you able to gauge in, by not showing some sort of stigmatizing nor having your impression on them, you will get to know more from them. Believe me, when you go in this manner, you'll be knowing more from them. While you know more and understand more and they share more with you, you could actually figure out more things of the scenario. That's number one. Yeah? And number two, when you mention there's a childlike behavior, they are still growing, because childlike behavior is a point that we want to look at as well. Is this happening only now, or has it been always having this childlike behavior and it is not progressing from there? Yeah, probably, it's too general for me to talk here, but a childlike behavior, which is like way, way below the age, is something that we might want to discuss and look further in a more professional manner. Yeah, because let's say it's 11, but, a lot of childlike behavior, and at a very young age and not progressing. So this is something that we want to take note. Yeah, it's a bit worrying. Yeah, of course, we need more this in general, but if it only happens during pandemic, or it's showing some sort of looking for attention or very clingy, we need to differentiate this. Yeah, it depends on what the childlike behavior is. Yeah? I hope it answers, but definitely by all means, yeah, I'm open for a further discussion or more personal kind of interaction. Okay? So maybe I throw it back to the MC, Mr. Hanif.
Okay, thank you, Doctor, for your answer. Okay, the next question is from teacher Nadira STAA. How can teachers play a role with students dealing with parents who are undergoing stress and creating the unsafe environment at home, feeling paranoid just listening to their footsteps in house? Uh, can you
Oh
catch what I'm
dear,
saying?
that's why I said, yes, yes. That's why I say teachers, sometimes you are not only handling your students, because you need to handle the parents as well. And yes, everything, this pandemic has created lots of changes. Parents are also having their own problems and affair. They are coping as well. So what could you possibly do is, teacher, as I said, try to reach out to these particular parents. If you could, yeah, have a talk with them. Sometimes because they are in the scenario, they could not see clearly what is not right or what went wrong. You as the third party, which you have seen in the child and you have seen the parents, with your experience, I think it's a good and fair square for you to talk to the parents. Yeah, share your knowledge and what you observe with them, and probably if you think this creates a very a not safe environment, then probably you should advise the parents to seek help. Of course, you can't gauge into it so directly, but you could actually ask them to seek help from the professionals. Have a talk with them and call them, try to understand and give them your opinion and ask them to seek help. That's very important. Yeah, and if you could, sometimes, yeah, you might notice that, oh, okay, the mom is a bit anxious, or the father is a bit too paranoid. Probably you can talk to the other family members as well, of a third party, to look into the problem, because you can't take care to the family affair, but to a certain extent you could reach out this to a person who could assist that particular individual. Because if the parents are not handling and not coping, as we mentioned, our children's well-being will be affected. So please don't feel yourself busybody, or don't feel yourself interrogating. No, as I mentioned, don't ever try to reach out, have a good talk with the parents and point out to them. They might be clouded, they might not be able to see that. But you who saw it clearly, I think you can convey your message to them. I think this is a form of help. Yeah? I hope it answers. Yeah? Thank you. I'll pass
Thank
it
you,
back
Dr.
to
Fong.
Hanif.
Thank you very much, Dr. Fong.
Welcome.
Okay, the next question from Aini Mustafa. I also facing problems with my son playing gadgets. Can you give an advice on how to tackle this problem?
Yes, gadgets. Oh dear. This is something that is quite difficult. But having said that, yeah, I don't know, Mr. Hanif is smiling. Probably he is also playing games, yeah? Just kidding, yeah, MC. No, you see, with children, there's something, this is a form behavior. Playing gadgets is a habit. It has formed a habit already. They have slowly and formed it as a habit where they will want to do it, they will want to play it, and they want to go for it. I really discourage, because I've seen lots of children coming in having attention problem, having focus problem, which arise from the gadget. If you could allow me, and if there's time, let me explain to you the analogy of it. Because playing the gadget, yeah, online, yeah, let's say those driving, racing or fighting, or anything in the online world is so fast. So 1 minute it's already, don't know, 24 or how many things has been flying through. So when they're engaging in this, and when they're in class, when they see the teacher teaching in front, they will see, oh my God, teacher is so slow writing at the whiteboard. But that is our correct pace. But for them who has engaged in online gaming, they will see the teacher is so slow, but our speed is normal speed. It's just that the online world is too fast. When that happens, when they are in the class, they will start to feel so boring. Oh, your teacher is so slow. Then they will start to do something. They will start to lose focus. They will start to talk, or they will start to shake their chair, or something else. This is the chronology. And what's going to happen? Whichever teacher is teaching in front, nothing goes into the CPU. Nothing is taught. Teacher might be teaching 10 types of fruits in front. He felt boring. He might just listen 7. 7 comes into the brain, into the CPU, stored. Okay, CPU might not be 100%. It might lost 2 or 3. So in exam, you see that 5/10, 4/10. Why poor performance? It actually comes from this chronology. I always make use of chance and to tell, of the effect of, gaming. So you would see this, 4/10. Why is this academic performance? When you look into IQ, no problem, smart boy. Yeah. So this is the thing. It comes from the attention, the focus, and the process of storing information was disturbed. Okay. So how do we handle that? With that had happened, we need to, you cannot cut off totally, yeah? Okay, gaming is bad. Dr. Joanne says it's bad. Later on, you're not going to perform. No more gaming. Cannot. They will protest. So says from 2 hours, we are going to cut into 1.5 hours and let it go for a week. Then we cut to an hour. We have to slowly cut down, but don't suddenly stop everything. You cut down by 30 minutes, last for a week, then cut down a bit more. You cannot stop them because later on, I'm telling you, if you stop them from playing games or Dota or whatever, then they'll have problem with peer pressure. Your friends will laugh at them. What? You didn't play? Oh, you don't know this game? Then that's another issue. We can't stop because in this world, current era, it's everything so digitalized. We need to allow them, but with certain amount. So the first thing you could do, it has formed the habit, you need to slowly reduce it. You can deform the habit actually. So you cut down half an hour. Cut down half an hour. You must have a time frame, yeah? And reinforce good behavior. Introduce new things to replace that. Introduce new creative play or activities to replace the online gaming. Get them out to engage into family activities. Yeah, when you're cutting down, you introduce something new. So you pair up together. Then you cut down a bit more, this one. Or, okay, when things are stable, you will start to implement something we call as punishment. We no longer hit our child. We no longer cane them. But you take something that they like from them. Fair enough. So let's say if they misbehave or certain things, I'm taking out your 1 hour gaming for this week. That's about it. We don't punish, we don't cane, we don't have physical exertion, no. But we are taking out something that they love from them as a form of punishment. But you need to form the pattern of slowly reducing because it has already formed. So now you need to deform it, yeah? Which we can, yeah? And control it to an appropriate level, comfortable for you and comfortable for your child, and not creating any other problems. Fair enough, yeah? So, but you have to cut down and give it a duration, cut down a bit, give it a duration, and introducing new things to complement together. Then it works stronger. Yeah? Okay, thank you. Thank you, Mr. Hanif.
Okay, I hope that answers the question. Okay, the next. Okay. Okay, so the next question from the YouTube live channel from Muhammad Aizuddin. He asked on how to implement timeout effectively when we have younger children. The timeout is for elder sisters. So want to time out for elder sisters while we have younger children. Did you
Okay.
get that?
Yes, I hope I'm getting it correctly. So you intend for the older one, but you're having trouble with the younger one? Maybe
Implementar
if the
it
parents is
for
the
young. Yeah, I think so. Like that.
okay.
Doctor.
So I think you see, because timeout session will be different for different age. Yeah. So while you are implementing it, it's okay if you it's okay that you tell the younger one that okay, Kakak has to go for a timeout because of this. Yeah. So you're gonna continue with some other activities. We redirect them for some other activities, while the one who's supposed to be reprimanded for a timeout should undergo timeout. Then once it's done, you go back to that and explain and talk about the whole timeout process with your child. Yeah, it's okay that the younger one is here, or maybe sometimes you say, "Allah, the young one is crying. There's no time to handle." But we need to manage it. Consistency is very important. Once you fail in your timeout or you're not consistent with your timeout, your child is not going with your timeout anymore. Yeah, we cannot slack in this. Yeah, you need to implement by holding to the younger one. Yeah, once it's done, you need to have time for it, for a sort of post-mortem. You need to have time for it after the timeout. Yeah, but you might possibly need to engage your younger one into some other activities. And it's fine if you want to put it, if it's not too young, you can get them in to understand the whole scenario. A post-mortem together, it's fine. So that this is what's going to happen. You want them to understand. Yeah, it's fine as well. Okay, so you can do it together if it's not too young. But if you think the younger ones might be crying or disturbing, you might engage the younger one into another activities while you need to have a session after the timeout with your child and explaining to them. We do not want to put it as a form of you reprimand them, but no, you actually talk about it later. This is very important. Yeah, that after the timeout, the session of talking about it is very important, and give them the affirmation after that. Yeah, this is very, very crucial. Yeah, if possible, try to get it very privately. Yeah, but if the younger ones could engage in, it's okay. But I do hope for a one-to-one so that they understand the whole thing and they feel that okay, the session is between she and the mother. Then they could understand, and it's a firm, assure. Okay, then we move on to another activity. But the younger one can be introduced that why this thing is being happened. This is important as well. Yeah? Okay, thank you. I pass it back to Mr. Hanif.
Okay, doctor. So the next question from Nada Zulkifli. There are mixed views about rewarding children for good behavior. Some believe it encourages children to expect rewards for behaving well, when good behavior should be done out of honesty. What are your comments on this?
Mm-mm. Yes, I do agree that this is definitely something that hits between 2 points that they should be doing that. I shouldn't be rewarding my child for doing this, isn't it? And it should come from them. But fair enough, if we are not giving big rewards. For me, sometimes reward can be as deep as a hug or a few words of affirmation, getting them into the picture. We are not giving those big stuff like, big toys, those games or whatever. As simple as one ice cream, to me, it's okay because you are not giving it there and then. You have to set a time. Yeah, reward system doesn't happen that, oh, today you behave good, tonight I'm giving you the reward. No, if this is the case, then it is not helpful. You need to train them for a series of good behavior and enforcing it, because I believe once it is enforced in the long term, it becomes a habit. We are forming a good habit. With that good habit, it will be regulated as something that they will do on their own later on. We are not giving big stuff, no, but we are giving something more sensitive, something more close to them, small little gift to encourage. We are not buying them. But as time goes by, when it has formed a habit, it will be self-regulated. This is what I believe, that it will be self-regulated and they don't work for reward anymore. They work because they have learned that this is doing well, this is good for them, and this is in them. And it will work that way. Unless you keep on buying with different things, yes, that is not healthy. But if you form a nice stream of reward system, nothing big, nothing too fancy, and it will form a habit and they will regulate it on their own. So you don't keep on reinforce with reward. Yeah, it doesn't happen this way. But we wanted to support the change of the bad behaviors, let's say. We wanted to kickstart it a little bit. This is something that's going to help. And later on, it's going to be something that's regulated within them. Yeah? So this is my point of view that it's not going to be harmful in any way if it's being used in the right manner, provided the stream is being formed and we are not giving big and fancy stuff, and we are expecting that it will be regulated on its own later on. Yeah? Okay, I pass it back to the MC again.
Okay, Doctor. I believe this is the last question from
Wonderful.
Adil. I have two sons aging from age of 14 and 11. They are always complaining, unhappy, not listening to us, and started to shout since the last 5 months. Please advise us.
Okay, 11 and 14 again is the crucial age again of growing up, understanding self, as I said earlier. Yeah? So they are saying that they are not happy because they have started to put in more concrete, deeper feelings. They are recognizing all this kind of emotion and they are at that stage. I think we need to accept that this is a stage that they are undergoing. Very difficult time. They themselves are having a difficult time. And it was actually sometimes being thrown out to us. But we need to accept that this is a time where it's a bit more, if we're saying difficulties is 50%, maybe they have another additional 20 in them. So it's a 70 for them. So we need to be more sensitive and acknowledging that this is a process. This is a process that they are self-discovery, they are lots of turmoil in them, physically, emotionally, and peer pressure. First of all, we need to accept and acknowledge this is a process. Number one. No choice, want it or not. We cannot put ourselves like last time when I was younger, by 13, I already started working, do part-time or do this, do that. We the mothers, parents. Unfortunately, no, this era, they are so into this process. Yeah. So we need to acknowledge it's a tough process and we need to be there, sit down and try to understand. Don't play a role as a mother or as a father. Seriously, no. You need to be a friend. You need to be a friend, showing them sufficient of attention, showing them sufficient of interest. You wanted to know, show them the interest that you wanted to know them. You have to slowly build this up because for them to show that they are not happy, having temper, and we need to acknowledge this is a season of pandemic as well. Lots of restriction in them. So we need to counter it with them, face it with them. Sometimes it's as good as, I like to encourage parents to use the word we with the children. Let's say the child is having difficulties in terms of completing homeworks or having some problems. Use the word we. Okay, we look into this together. Do you know the burden at the shoulder would actually drop half because it's being shared, you and your child, because we do it together. We find out together. We learn this together. Do you know how much they will feel relieved that 50% is gone, not so heavy anymore? When it's not so heavy anymore, they wouldn't be so grumpy anymore. They wouldn't be so upset anymore. And that is the time where you can come in, show your interest, to know, to understand from them. Yeah, because what being raised by the participant, it's during the COVID, the pandemic. We have to address all these external sources here. Yeah, and give it some time to look into it. Okay, please give it some time to show your interest, form your bonding again, understanding it, acknowledging, validate their feeling. Don't brush it off. When you brush it off, they are not telling you anymore. Yeah, sometimes we're not purposely trying to brush off. It's just that we feel that, that simple, that small things are that nothing, for us might be like this. But we have brushed off their esteem, we have brushed off the intensity of the problem. Then that is how they starts to close the gate, guarded. But then they do not know how to handle. So it's reflected to you again. So this is a continuous cycle. We need to break the cycle. You need to get into the picture and go into the same level with them. We face this together. We try to see this problem together and at their level. Don't say, I'm your mother and I'm going to discuss with you. No, it has to be at their level. Just nice, show your interest, talk about it, solve it together. It got to be this way because it's two things together: pandemic, the turmoil during the adolescence process, and some sort of a coping mechanism. I would say this is a coping mechanism that has not been formed in a healthy manner. We have to reform this thing again. Yeah, I hope it answers. Yeah, so I pass it back to Mr. Hanif.
Thank you very much, Doctor, for a very fruitful discussion, valuable advices, and knowledge sharing. Before we end the event, let us all join for a photography session. Everyone are encouraged to open their camera.
Who's gonna count? 1, 2, 3.
Saya, Doktor.
Okay.
Okay, semua dah ready ke? Okay. 1, 2, 3. Alright. Nak ambil lagi satu? Okay. Okay. 1, 2, 3. Alright, done.
Alhamdulillah, we have come to the end of today's program Bicara Kesehatan. I hope all of us gain something from today's talk and practice what we have learned in the future. Once again, thank you so much to our speaker, Dr. Saljo N, and also to all attendees who are willing to slot into this event into your schedule. I would like to apologize on behalf of the organizer team for any shortcoming during this session. A feedback form will be given by the technical team. We hope you can spend time to fill it and please give a very honest feedback, suggestions, and encouragement that is meant for our improvement. With that, Assalamualaikum warahmatullahi wabarakatuh and see you again later.
Waalaikumsalam.
Waalaikumsalam.
Thank you everyone.
Thank you so much. Thank you so much.
Thank you,
Thank you, Doctor.
Sal.
Bye.
Thank you. Bye.
Bye-bye.